Welcome to the Tenet Healthcare Medical Minute. I'm Julia Yarbough. Our topic today is epilepsy, and joining us is Dr. Pedro Hernandez-Frau, a board-certified neurologist specializing in neurophysiology and epilepsy. Dr. Hernandez-Frau practices at the Palm Beach Neuroscience Institute and is also a member of Tenet's Advanced Neuroscience Network. Dr. Hernandez-Frau, thank you for joining us.
Thank you for having me.
What is epilepsy?
When you have two or more unprovoked seizures, that's epilepsy. It is a disease of having seizures.
So what is the difference between epilepsy and seizures? A lot of people think that it's the same thing.
Correct. A seizure basically is the event. The disease is epilepsy. A seizure is an abnormal brain activity with many clinical manifestations depending on the area of the brain that is affected. For those patients that have the tendency or the disease of having seizures, they do have epilepsy.
Talk to us a little bit about what specific triggers for epilepsy, and then are there any particular symptoms?
Alcohol may be a trigger, infections, strobe lights, stress, being sleep deprived, being dehydrated, starving, things like that may trigger seizures. Symptoms-wise, it depends on the area of the brain that is affected. You can have staring spells, jerks, shakiness, tremors, numbness, visual auras, or seeing things that they're not there. So there's different types of symptoms depending on the area of the brain that is affected.
So as a doctor, how do you diagnose epilepsy in a patient?
Good history, a good physical examination, and then we go through a series of tests, which we always do some blood work, we always do brain imaging. Nowadays we rely a lot on brain MRIs, and EEG, which is the gold standard test looking for seizures. Basically it's a brainwave study that will let us know the electrical activity of the brain.
With all of the medical advances that we have, what are some of the treatments now available for epilepsy patients?
Well, the first line of treatment is medications. We have 20 plus different medications in the market right now approved for epilepsy. Now, when that fails, we always have surgery. There's resective surgery. If we're able to pinpoint specifically the area of the brain that is affected, that it doesn't deal with memory, language, motor, sensory, and stuff like that, vision, you can potentially take it out with surgery. There's a few devices nowadays that they're approved, FDA approved for epilepsy. One of them is called a VNS, which is a vagal nerve stimulator. It's a device that is implanted underneath your skin, and there's a wire that wraps around the vagus nerve here in the neck. And it will give you a discharge every few minutes, depending on the settings.
This is great information. Thank you so much, Doctor.
Thank you very much.
And thank you so much for joining us. I'm Julia Yarbough. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.